I would say don't buy. Don't buy. Grey's Anatomy, you can. This is a genuine thing. All of you, please keep yourself in the mute and don't unmute yourself unless there is a need. Because I have not put any restrictions. So I just do that. So coming back to this, don't buy Grey's. Grey's Anatomy is pretty good. But the problem with Grey's is it is extensive, right? So we don't
Recording in progress.
We don't want to overburden it. What we really do is, as we learn the subjects, right, whatever is needed from the Grey, that will be taught to you. But regarding BD Chaurasia, you can't afford to skip anything. That is compulsory. If you read Cunningham's manual for dissection, it's giving you wonderful guidance. Right? Actually, how to dissect, what are the structures which will be coming up, that will be pretty nice. The third thing, conceptually, I'll be taking care of, that is the embryology. If anyone is weak in embryology in medical science, trust me, the concepts, they will be so bad, they'll be so shaky. Right? So we don't want that. Definitely don't want that. That should be the weak from anyone. Yes, Vikram Singh anatomy is good. Then Veer Singh, that is also very good. And regarding the embryology, we'll be actually taking say things in very much detail. So don't worry about that also. So this one is for the anatomy. I'm telling you the basics. For the physiology, Sambulingam, Indian author, good for exam. Right? A book for embryology. This is IBS, Mbbs Singh. Right? Mbbs Singh. IBS. That is a book, good book. And another good book is by Vishwa Singh. That is also good.
So can I ask?
Sure. Go ahead.
So you are giving all this, you are telling us BD Chaurasia and this book, but Vishwa we are getting book.
Alan, can you repeat what are you telling?
Vishwa is providing us book, so how can we choose that book?
I think Vishwa must be giving you the e-books. What I'm talking about is the physical books.
No, actually, that ma'am has said me that we have to pay 40,000 for the book, for the whole book.
Acha, okay. So in that case, they must be giving you at least these books. Because if it is like they are giving you physical books, I'm not very sure about it. So just confirm it with the management. Okay? Just confirm with the management regarding the BD Chaurasia. BD Chaurasia is needed. Whatever the thing, basic. BD Chaurasia is that book where things will be explained in the form of that, say, as we'll be discussing. When I say, okay, this is the heart, right? Now, heart doesn't look like this, heart looks like this. But for the understanding, right? For the understanding, yes, wait. I'll write all those things. For the understanding, these type of images, they play a vital role. Right? They play a vital. So that's why BD Chaurasia is where when many of the things would be drawn. There will be line diagram, sketch diagram. But they are important for the concept. See, otherwise I could have said that, okay, go for Grey's Anatomy, fantastic book. Everything is, the images, they are so vivid, so fantastic. But put that much in brain, not easy. You have got a limited time. Right? It is in specific time you are supposed to finish anatomy, physiology, and you have to move on to the next one. Right? Yes, you are right. For BD Chaurasia, there are 4 volumes. One is the general anatomy, and then the part 1, part 2, part 3, in which there would be upper limb and thorax in part 1, lower limb and abdomen in the part 2, and the brain and head and neck in part 3. And one book is for the general anatomy. So kindly confirm that you definitely get these 4 volumes. They are important. They are important. Now, the thing is, this is my personal. When I say that, so this is how I have studied, right? So this is my personal. Now, in case if anyone tells no, मुझे तो Grey's Anatomy पढ़नी है, definitely all the best. Definitely you can do that. Say, this is my perspective, and definitely I'll never misguide. I have read Grey's Anatomy, but not fully, and definitely not in first year. In the final MBBS, when there was some kind of how this entire structure is, go back to Grey. And then during surgery, when you study, you get the clarity, that's when things really strike. Because it is like at that point of time, during the surgery rotation, when you come across that, okay, this is how the liver is say this liver is the surgical incisions they are put, and these are the structures which are cut, and this is how internally the biliary apparatus looks like. So that is when you go and read only that topic and things become crystal clear. Though it would be explained fantastically into our surgeries, right? But still, for some more clarity, so abhi se tension mat. One normal mentality. You know what happens? Don't take me wrong. I was also in the same boat. पहले 6 महीने अरे मैं दुनिया का सबसे बढ़िया डॉक्टर बनूं, जितनी बुक्स है, whatever the books which are available in the world, मुझे सब आना चाहिए. After 3 months, suddenly you come to the reality कि बस course book है. Now control yourself. Right? So like that, welcome, control Uday, control. It happens literally like that. So thing is, genuinely, consistently work. If you buy each other's book, then we can refer Grey's Anatomy library, right? Absolutely. मैंने वही तो किया था, मतलब out of sheer enthusiasm, was dad को बोला Grey's Anatomy खरीदने. But very soon got the Brahm Gyan libraries, they are good. They give you the books. Why to buy such expensive books? Showbaji ke liye, this is very right. That's just what I said it in first lecture. Biceps ban jate. So coming back to this, Bidi Chaurasiya is what I would suggest. Any of the atlas, right? Wonderful atlases are there. Cunningham atlas is there. This Gray's atlas is there. Many of atlas. Again, atlas अच्छे हैं. लाइब्रेरी में सभी लाइब्रेरी, दुनिया की सभी मेडिकल कॉलेजेस की लाइब्रेरी है. You will be getting those atlas. Sub. And when do you need atlas? From atlas you can never study, because in atlas images there will be tons of images. It is exactly like if the Rolls Royce is going on the road, but if you don't know what Rolls Royce is, right? If you don't know what Rolls Royce is for you, it will be not like just a car. Just a car. So, first you study the subject, study that topic. Once that topic is clear, then when you go into the atlas. So atlas, what is there in the atlas? In atlas, there will be images, only images. So it's like as if you read the abdomen is shown, you remove the anti-abdominal wall, passes one by one. So there will be all the dissections, sequential dissections, they will be available. There will be images which will be labeled, right? So that you can create that image in your mind that how structures are. But as we'll study, right, we'll try to create those images in your mind so that you never forget. But atlas will be having thousands and thousands of pictures, thousands and thousands, literally thousands and thousands. So don't worry about any of those things. The point is, start with the systematically the way we are now today starting physiology. And for the anatomy, as I said, you go to our channel, right? Under same my name, right? Same, this is the name, Dr. Bankim Jani. Same channel. Open the upper limb, not anything else. The upper limb playlist, right? Go to upper limb playlist and start with the first video. Now those videos, they are in the duration of about 1.5 to 2 hours. दिन का एक वीडियो देखना है at your comfortable pace. The PDFs, there are links available from where you can download the PDF. And then, if needed, write your own notes. That this is the point. Yes, write your own notes. Once you complete a video, revise only the PDF. You don't have to see that video again. Nahi, because the PDF they are handwritten. So once you have seen the PDF, parallelly to that, no, it is not the website. So it's YouTube. On YouTube, just you put my name, Dr. Bankim Jani, and everything is there. The entire anatomy, all the regions, yes. Playlist name is upper limb. Upper limb. So anatomy is divided into upper limb, lower limb, abdomen, thorax, head and neck, and brain. So this is the order which everyone has to follow. Start with upper limb, and then you have to go for it. Because in upper limb, there are several videos. Every day, if you keep on taking one by one, started from your previous, nice mission. You keep on doing it. What I'm telling, see, go in the order. So it is as if this is the thorax, right? This is the upper limb, and you peel off the skin. You peel off the first muscle, then what do you see? Then we'll be coming across the brachial plexus. The entire plexus is fully dissected one by one, every artery, every nerve, vein, everything, till you reach to the last one, that is dissection. And it is along with the applied anatomy. What applied anatomy is, let's say, for example, if there is someone hits a lathi, so then this is humerus, so then that humerus is broken from the shaft. But that's not the case if someone falls on the outstretched hand, right? On the outstretched hand. So then the clavicle would be fractured. Now, why clavicle would be fractured at the junction of third and one-third? Because that's where it is taking the turn, right? So when it is taking the turn, when the curve changes, that is, say, the weakest point. So that is where. So then there will be several X-rays. Multiple X-rays are there. Real X-rays will be shown. It will be shown that normally it is, right? And when it's fractured, this is how it would really look like. So that's how things would be proceeding. So it would be with applied anatomy, with all options. Right now, don't worry about it. Don't write any notes, nothing. Just, and today, by the end of today's session, what I'll be doing is this PDF, straight away I'll save and I'll put it over. So you can download it right now. Aati khatam. Wo baat ki baat hi nahi. Right? I'll put it into the chat so that it reaches to everyone, and then you can have it. Right? That's it. Regarding the books, whether you have to buy, I would say, I don't want to create any confusion, because as you said, Vishwa is giving you the box. Right? Recording deliberately right now, I am not insisting on recording. The thing is, it is like you and me are talking directly. The moment recording wala chakkar comes into picture, so people feel this is like our past experience. Immediately the presence drops, and what everyone feels when many of the students feel recording hai na aapke paas, baad mein dekh le. Trust me, that baad mein never comes. It never comes. So if I'm coming regularly, sharp at 10:29, it would never be like 10:31. Why can't everyone come? Why can't everyone come? When you posted this question, I just came means what? This is 10:46. My dear friend, this is 10:46. That's pretty late. Regarding the recording availability, etc., right, don't worry about the recording part. It is like learn it right now as if I'm sitting in front of you, and you are allowed to ask as many questions as you really want. I'm not putting any restriction on that. So that's the whole idea, that when we say live lecture, there is a difference between. Otherwise, so kya? Why should I strain so much? Tell me one thing. Done. Right? Just sit one day, recording start. And this is cellular fluid 1, cellular fluid 2. 6-7 lecture record करके दे दी, चलो do it. Now I am free for 2 weeks. है ना? But no, we don't want to do that. नहीं करना ये. Because recording is recording and live is live. पॉइंट भी समझ ना आए तो आई इन फैक्ट इंसिस्ट यू, मैं आपको बोलता हूँ कि दोस्त पूछ अभी, आस्क राइट नाउ, डोंट वरी अबाउट मैं किसी कोई पूछे तो मैं मेरा जवाब नो, इट्स लाइक इफ आशीष, यस आशीष आई एम टॉकिंग टू यू डायरेक्टली, मोनालिका तो यस मोनिका आई एम टॉकिंग टू यू डायरेक्टली, भूल जाओ दोस्त, इट इज लाइक कितने भी लोग, मतलब यहाँ पे 300 लोग भी हैं तो जस्ट फॉरगेट अबाउट रेस्ट टू 99, नहीं, भूल जाओ, इट इज लाइक 1 to 1, नहीं समझ आया दूसरी बार पूछो, स्टिल नॉट तीसरी बार, स्टिल नॉट 10वीं बार, 10th टाइम. And giving the example, yesterday I was in USMLE lecture and in which I was teaching about anesthetic agents, right? Anesthetic agents. Now in anesthetic agent, there are several groups. One of the group which is called as the neuromuscular blocking agent, right? It is called as the neuromuscular blocking agent, and one of the substances, it is the succinylcholine. Right? Just and with 1 minute, right? So that is the action of succinylcholine. This is a very powerful drug, succinylcholine. Now, succinylcholine, it acts in two phases. One phase, phase 1 and phase 2. That is in phase 1 when the sodium channels they open and then they close, and in the phase 2, it is what is called as a phase of desensitization. Now, this is such a dangerous drug because the moment it is given, it acts in seconds. It works so fast. So this is the reason that this is to be given when you want, that patient has come, patient is unable to breathe, and you need to do intubation, right? Tube dalniya because you have got only few seconds with you. And that's why you give imotidil, that is the anesthetic, and then you give the succinylcholine. You give the succinylcholine, action starts, but then there are so many side effects of succinylcholine. But the biggest advantage is it washes out very fast. It acts and its effect goes away. So that is where you need to know about the phase 1 and phase 2. Right? These are the phase 1 and phase 2. Now, this phase 1 and phase 2, they are bit tricky, bit tricky to understand. Because one sentence in USMLE, the one sentence is like that acetylcholine esterase inhibitor, like say pheostigmine or neostigmine, they can't act. They will make the patient worse in the phase 1. They will help a lot in the phase 2. Now, this is to be understood very clearly. It happened like I had to repeat this thing 6 times. 6 times. Normally, our lecture, which gets over at 9 o'clock, got over at 9:45. It started at 7. No worries. After explaining for the 6 times, I said, now let me take a test. That was the reason that I randomly picked up 6 people, one after the another, and asked them. And then I was satisfied that they are knowing. Still, it was asked that, is it clear to anyone? Why it matters? My 15-minute, half an hour, 1 hour, it really doesn't matter. But what if anything goes wrong to the patient by you? If you have not understood this topic, but that's the tension. That's the intention. This is the importance of a live lecture. Otherwise, recording तो क्या यार, ये मैं आपको टॉपिक दे देता हूँ, on YouTube मारो सर्च, 50 recording मिलेगी, बस खत्म. There is no need. The live means yes, दोस्त मेरे सामने बैठ के now you study. Until you are satisfied with it, you say कि हाँ आप दिमाग उतर गया. Now I can explain it in my own words, then I'm happy. So this would be our intention. So copy recording, हाँ recording चल रहा है, it is there, and if needed, I don't mind giving it to you, but don't rely on it. ये मैंने पता कब देखा? When I realized it, I am a member of that Amazon Kindle, right? Kindle Unlimited. So they give as many books as you want. I'll answer all of the questions. So this is like Kindle Unlimited. They give you as many books as you want. Now it is like, see, you are paying, say that 175 rupees a month, right? फिर वो लालच आती है, 175 में कितनी बुक्स पढ़ सकते, And then every day you read about 50, 60 pages. By the end of the month, कम से कम 10 से 12 book तो खत्म, and you are happy. And I have got some downloaded PDFs, right? Some downloaded PDF पढ़ी नहीं जाती. It happens that अरे है ना अपनी hard disk में है ना, yes, this is in my this drive, right? There are so many books. I feel bad कि क्या किया, मतलब books store करके रखी हुई. In your laptop there must be several movies, right? जो हम कभी नहीं देखते कौन Netflix पे जाके live देख. So this is human nature. At times we feel कि हाँ अपने पास है, but where do we spend that much time? नहीं मिलता time, नहीं मिलता. जो live हो गया, the things what you learned is learned great. Old PDF, right? If you got the old PDF, I mean PDF of the older version, no problems. Anatomy changes hardly. There are some changes hardly. So even if it is one edition back, you don't have to worry. I think that would be fair enough. Mgmt is physiology subject. That's right, Siji. It is for physiology. One of your students handed a note, so we get an idea how to make cover home. Students handed notes, you take my handed notes. Right? Why to bother for that? Guyton good for the first year. Guyton is what I have read, what I have enjoyed. Guyton, and in fact, whatever I'll be teaching you, it will be from Guyton. Guyton is like a story. From exams preparation, Guyton is not a good. Right? Guyton is like my favorite, but still I'm telling you that Guyton is not for exam. Guyton is for understanding. And at this point of time, don't worry about the exam. Don't worry. This foundation, this learning, that foundation should be strong. Abhi se kya, say one of you have written the email that I want to do post-graduation in cardiology. What should I do? I have written you the answer, right, in one word. Pass first and be first. So, abhi se kyun? This is good, but come down to harsh here. BD Chaurasia is for anatomy. Is for anatomy, right? BD Chaurasia. It is for anatomy. Ganong, good. How to revise? Whatever the things which are taught today, आज उसको revise करो. Go through the PDF. Say for example, even this question I must have answered 100 times. In anatomy, आपने एक वीडियो देखा, right? Its PDF is available. Download it, watch the video, and आराम से PDF scroll कर, so that you know that yes, I am understanding this. Right? नहीं समझ आया, just go back half of it, understand the topic, understand that particular point again, onto and keep on working. Finish the video. Then a video देखने की जरूरत नहीं. This PDF is now everything, because it is a sequential, right? It's a sequential, right? And then this PDF, we have to go from first page to last page. Okay, hogi ki 30-40 page, and only the figures. You must have seen that I hardly write full long sentences. So that PDF is what you have to revise. That's the method of revision. Simple. Acha. Regarding, okay, just don't type any questions because I need to answer. Just stop. Please stop. Don't write any more questions. Please just wait. Because there are so many, so I'll answer them very fast. How to revise? Yes, I told you. Mgmt is a book for physiology. Yes, it is book for physiology. Ganong is a book. Regarding the time management, there would be one specific day for time management. This is in my mind, right? So when every one of you will say, yes, chalo, this Saturday or this Tuesday, you decide the day. कि आज पढ़ने का मूड नहीं है. We'll discuss about the time management. It will be something which you should be able to find immediately. So ये तो पक्का है. And this is for everyone, right? Just mutually all of us will decide, and then this is active recall. gentlemen, this is what is called as the active recall. When you are reading the PDF, because then the topics will be running in your mind. अच्छा, मुस्कान, एनाटॉमी के वीडियोस जो है दे आर ऑन द यूट्यूब चैनल. फिजियोलॉजी के जितने भी हैं दे आर फिजियोलॉजी, द पूरा फुल फिजियोलॉजी विल बी डिस्कसिंग ओवर हियर लाइव. ठीक है, फिजियोलॉजी इज द लाइव डिस्कशन. नो नीड टू राइट द नोट एट ऑल. You don't have to write. ये तो मैं डिस्कस किया. Regarding the what is the essential series of essential series of anatomy is, again it is what I really feel that जब anatomy पढ़ना है तो some of the things they should be crisp clear. So in essential series, those important concepts of the anatomy they were discussed. That if you know that, to make your rest of the journey, that is from second Mbbs, third Mbbs, very fine. We are going to start with physiology, right? So now we'll be starting with physiology. Digital notes or handwritten notes, your choice, your choice. I would always prefer, say, handwritten notes. PDF to in any case be getting. So that's why we said that handwritten notes. You write few important points by yourself. Start with upper limb in anatomy, right? First the upper limb, then the lower limb. पहले इतना तो खत्म करो, चलो बोल दे. Then the next is thorax, then head and neck, and then the brain. The reason upper limb, lower limb, they are flat, right? Flexor component, extensor component, two surfaces, right? तो आगे पीछे सब समझ आ रहा है. Thorax, suddenly the big structures, that is lungs, heart, big structures, right? Abdomen, so many structures, right? The entire GIT, the endocrine system, so many. And then the head and neck, very delicate, very small structures. And finally the brain, it is just super. So when you follow this order, it is in the increasing series of complexities. So that's why I insist that start with the upper limb. Right? You will be very happy that you took this decision, because it will keep on building your anatomy up so strong. That's the reason that in case of physiology, we will start with that topic, which is very sweet. But then our next topic would be like, straight away I'll put you into the clinics. This is the patient of burns. Now tell me, whatever you learned last time, now tell me what should we give to this patient. That way, you will never be panicked. अरे यार burns का patient आया, अरे यार तो इतने सारे swelling है, leg swelling, right? Heart pump खुले हुए, what to do? What fluid to give? Why this fluid? But once your understanding is clear now, that what is hyper, what is hypo, right? What is normal? So all those things will be playing in your mind, that this is what will be happening into the patient's body, and what you are doing is absolutely scientific. That's why you have to be very scientific and not the artistic. आपने stomach ऐसे बना दिया तो yeah, that is fine, right? Then you don't have to, अरे नहीं नहीं ये जो curve है, it has to be exactly like that. It's fine. It's fine. You should be scientifically correct. दिमाग में, your brain should really know that what you are doing. Yeah. अच्छा, चलो. You just put the bricks on questions and we just finish this part. So this was for the BD Chaurasiya, current man, and for embryology, either BC or Vishram. For physiology, this is Tamil and the kite Such a sweet book, right? And it is like as if you are just, you keep on reading on and मतलब book वापस रखने का, such good, very very wonderful explanation. But from the exam point of view, sampling, I would say that, because the things are given in the form of points. For exam pass करना भी कुछ, but at this stage, follow this pattern. That's okay. That's okay. For embryology, that 9th edition is totally fine. Achha. If you have not purchased any book and want to purchase, always go for the latest edition. And many times you will be getting that these editions, they are available in two formats. One is the Asian edition, and second is the US edition. Now, US editions, they are on the art paper, and they are very good papers. Printing is also very, cost is also very good because they charge dollars. कुछ नहीं फर्क पड़ता because we are Indian. Even simple सा पेपर हो भी क्या फर्क पड़ता है, we can very well comfortably read. ठीक है. Sambulingam. Let's write it again. Sambulingam. You asked same question 5-7 times. What was that question? Down. You have to start watching the video from today. Yeah, why not? Because right now you are free ना. So अभी के लिए physiology पढ़ो and spend about 2 to 3 hours for your anatomy. अभी का जो time है ना, it is a golden time. In next 2 months, 3 months, whatsoever you'll study ना, you'll be studying it without any tension. तो जितना खत्म हो गया, मेरे students जो हैं, what they used to say, कि बाद में अफसोस होता था, time waste क्यों किया थोड़ा भी? Because when you will be, again, not disgracing or not insulting or any college or wrong, but they said कि जो चीज आपने brachial plexus आपने पूरे 2 घंटे में आराम से एक नाव पढ़ा है, 15 minutes, and in 15 minutes नहीं समझ आता, दोस्त नहीं समझ आता. From there the video, it is on the YouTube. Go to my channel. These were the videos which were they are the actual sessions like we are doing it right now, but previously we were doing it on YouTube. So just unmute once. No, you won't need anything. You won't need BD Chaurasya. You won't need any book. Just focus. Just download that PDF. Keep that PDF in front of you and go ahead. Topic, name of the video, that's what I'm telling. YouTube, go on my channel, Dr. Bankim Jani. In that, there you'll find the playlist. In that playlist, go for upper limb. Right? बस अभी upper limb से शुरू करो, बाकी का सब छोड़ो. Don't do anything else. Right? Just upper limb. एक बार upper limb खत्म तो करो. Right? Will we understand? I don't know. Start doing it. अक्षर, ये तो how can I say? This is exactly like एक साधु जो था, वो एक आदमी आया, उसने पूछा कि अच्छा यहाँ से रामगढ़ कितना दूर, उसको कोई जवाब ही नहीं है, बैठा रहा. 2 बार पूछा, 3 बार पूछा, कोई भी जवाब नहीं. उनसे ठीक है, चलना शुरू किया. इतना दूर गया तो ही सेट के वापस आ, 2 घंटे लगे. तो कहते जब मैंने 3 बार पूछा तो जवाब क्यों नहीं दिया? द रीजन इज, मैं कैसे दे, मुझे क्या पता कि व्हाट इज योर. जब मैंने देखा कि इस स्पीड पे चल रहा है तो मतलब 2 घंटे लगे. आई थिंक यू गॉट योर आंसर. स्टार्ट डूइंग, हैव फेथ इन योरसेल्फ. और ये क्वेश्चन कभी मत लाना कैन आई डू इट. मतलब आई मीन जिन्होंने भी अब तक मेडिकल किया है, दे ऑल वर हैविंग 1600 grams of brain. It was the same brain with the same structure what you have got. ऐसा कुछ नहीं कि उनके पास there was some extra brain, और ऐसा कुछ नहीं है. They were having more than 24 hours. But have faith, start doing. कोई हवाई महल नहीं, and never be over confident कि बॉस my IQ के, ये तो ठीक है मैं अलग एज में पैदा हुआ, otherwise अल्बर्ट आइंस्टाइन तो मेरा स्टूडेंट होगा, right? I am with that high IQ. Never be under that impression. Never. And even to the student who stood all India level first, I have told him, boss, जमीन पे आ जा, then and then you'll be able to reach heights. Never try to overestimate. Right? You just consider you are a simple, सीधा साधा brain, and Once you study properly, you'll be able to read papers. Bas. ठीक है? So have faith. जरा भी नहीं. Soft coffee prefer करूँ या hard coffee? Hard coffee. Hard coffee क्या? ये जो बुक्स मैंने बताई, I prefer कि उनकी हार्ड कॉपी हो जाए. कुछ भी बोलो यार, वो when you touch the book, there is a different feel. And all those ebooks are like जो बहुत महंगी बढ़िया right? All those books where the images are to be seen. अब दोस्तों क्या फर्क पड़ता है whether you see that image on the computer screen or you see it physically. Image is image. उसमें कोई फर्क नहीं पड़ता. Atlas तो I always दोस्त कभी मत खरीदो. Atlas that should be on digital platform. I mean on the digital system only. क्योंकि you can zoom it, unzoom it, right? Scroll किया, all those things are possible. Books to use, Jia, books to be used here. Sambulingam, right? That will be for exam. But अभी के लिए it is the Guyton. And Guyton का अगर जो Asian खरीदोगे ना तो it is not expensive. It's not expensive. So worth it. If you have read Guyton properly, you know कितना फायदा होगा. See, if you read the Guyton properly, अभी exam भूल जाओ. Forget about the exam. Hall. That's right. Guyton and Hall. That's right. I mean, she's right. The full name is Guyton and Hall. And Hall. Right. हम तो Guyton नहीं. So, Guyton, if you know it properly, the immediate फायदा. I mean, immediate फायदा. फायदा is the immediate फायदा. Physiology तो आता ही. You'll be good in physiology. This concept which will be used in pathology, you will enjoy it so much because physiology is like study of nature, right? Study of nature. You might say study of nature. The father of physiology is called as Aristotle. What Aristotle said, that the way we have got this external world, exactly the same way there is some internal world, right? And that is where the nature moves. So he said that physics is nature. Logy means study. So it is study of nature. When we say anatomy. Tommy means to cut. Anna means to see. To cut and anatomy. So physiology would come. In Cunningham, there are 3 volumes. So it will help you in pathology. It will help you in pharmacology. That is how the drugs are. Pharmacology. And the best of all, when you will be implementing forensic science. Then you become like this, a doctor come or detective jada ho, right? Kya maza aata hai. And when we'll be discussing forensic, when I teach forensic science, every day it is one case, right? One case of murder, various ways of murder, toxicology, various toxins, zehar, and all those guns, and then how to go for the autopsy, that is the postmortem. How to see what are the structural changes. You see the dead body, so then you estimate that how much time has been passed before this person was killed or committed suicide. So that is from the rigor mortis. How will you go for the liver temperature? All those things, they are fantabulous, fantastic, absolutely great. The foundation starts with physiology. And there comes the clinical. And in clinical, it is the medicine. The big boss of the entire medical science, medicine. In medicine, you have to say, it is divided into 4 parts. Inspection, you just watch. Palpation, you touch. Percussion, right? You like this, right? To find out whether the underneath substance is air, thick, right, is solid. And finally, your auscultation. So inspection, palpation, percussion, and auscultation. And that's how you come to one conclusion. That is your diagnosis, and then the treatment goes back to physiology. So this is the advantage. Anyway, these things they are not there, but it is good to know that what we are studying is so important. Nothing is compulsory. Nothing is compulsory. But what I am telling is that just गार्डन खरीदनी तो खरीद सकते हैं, बाकी अभी नहीं खरीदनी मत खरीदो. Don't buy. Just यहाँ पे फोकस करोगे आपको चले. No, for anatomy अभी के लिए I am telling you just start with upper limb playlist. Right? General anatomy की अभी मत टेंशन. अभी कुछ नहीं. Just start with upper limb. Get that fit. क्या मजा आएगा. Yeah, muscle really looks like this, and then how beautifully the artery is passing through in between. If this is the bone, so then say like a girlfriend, that artery is going like this, right, winding around, and then when it breaks, yes, this artery also breaks. So then there would be hematoma, there would be blood collection. So it's important कि fracture तो ठीक करना है, but this artery is also to be repaired. So this will generate the concept. USMLE अभी don't even talk about it. ये बहुत देर है. What you are studying, there are no specific books, right? First aid and all those books बहुत देर है. First पहले foundation तो शुरू करो मेरे दोस्त. Start with the foundation, because if I tell you USMLE books, you will faint, because the topics which we are teaching, right? Say for example, if I'm teaching the upper limb, and it is taking 6 weeks to complete the upper limb. You know, in USMLE, how much time it takes to complete the upper limb? 4 hours. 4 hours. Because it is like a machine gun. Dart, one after another topics are. Because it is like predetermined. It is taken for granted that you know the subject. I am supposed to revise it. So the topics, they will be going at a dangerous speed. So even in USMLE books also it will happen like that. So अभी के लिए पहले चलना सीखो, right? Marathon में I'll take you to marathons, but वो भी देर है, right? Straight away आप 42 किलोमीटर भागेंगे तो next day आप खड़े ही नहीं. That's what I tried to explain in many of the emails also. Many of the emails I said this thing, that yes, it is good. मैंने क्यों USMLE बोला? So that you know, yes, there is something where students, where the entire world will be competing against you. पूरी दुनिया लड़ने वाली है, and you have to fight out and you have to come to that level. But पहले उसके लिए बेसिक तो शुरू करो. 36 को शेवलेन जो मूवी था तो उसमें he went to 36 chamber. But शुरुआत तो first chamber से की ना, from first step. And if you've seen that movie, that how many times he fell into that water, वही होगा. So foundation अभी के लिए just anatomy and physiology, because there are other things also, right? Biochemistry and this that. अभी कुछ नहीं, पहले इतना तो शुरू करो. Straight away मैं आपको 5 subject शुरू कर, doesn't make any sense. कुछ नहीं. These are the subjects: anatomy, where you know the structures, and physiology, you know how they function. Bas. Because the moment that it is said that, okay, now we'll be talking about the kidney, instantly you'll be knowing that, okay, these are the calyces, this is the ureters, they will be going into the bladder. Just unmute. Just mute someone. Arey. I easy. Did you participate in marathons? Well, 118 medals. I think in the second class I showed 118 medals, marathon, trail marathons, and the longest distance ran is 180 kilometers. Just before few months. Okay. So think this much is for the books. So in nutshell, we'll keep the thing simple. What you were told was the brain mapping, which everyone, I hope you are doing at least 10 brain maps a day. I hope you are doing at least 3 minutes of exercise a day, right? Every day. What's our target? Our target is 50 minutes of workout in 1 week. That's the basic given by uh, Rutu. Your mic is on. Can you turn it off? So 150 minutes of exercise as per the American Medical Association. They say that 150 minutes of exercise per week will keep you pretty fit. More, better, but at least 150. The third thing, 3 minutes of exercise, 3 liters of water a day. Water, 3 liters of water a day. And this is what. And the fourth important was, by the way, how many of you are doing that digital sannyas, right? That is no telephone, digital sannyas. 30 minutes before sleep. Before sleep. And you are really trying to go to sleep before at least 11. Anyone who is practicing all these four things. Oh, very nice. That's what I was asking in advance. Doing all of these things. Fantastic. Anyone else? One, Neha, Puja, Vaishnavi, yes, Ish. Just 2 hours. Very nice. Isha. That's good. Mhm. Okay. Arshit, if you're doing all those things, so then why not digital? 30 minutes to है 30 minutes but instead of 2 minutes 15-minute exercise. Superb, superb. That's very good. Forgot third point. कोई बात नहीं आज से शुरू करो आज से शुरू what is left out that's okay. चलो let's start with our first topic of today. Very easy topic but very wide because next time will be अरे प्लीज यार म्यूट करो ना I have to मुझे नहीं अच्छा लगता I don't put restrictions सबको लिबर्टी थोड़ा ध्यान So we'll be now talking about body foods. No problem. It happens sometimes. This PDF, as soon as we complete the lecture, I'll save it and I'll just put it over here so you can download. 5 minutes tak we'll keep the meeting on so everyone can easily download. So email karna, I'll reply. Right? Because this question is very long. So just email me. How to download? The moment I'll put it over here, you'll just click on it and you'll be able to download it. अभी कोई नोट्स मत अभी कोई नोट्स नहीं this book this PDF ये PDF ही आप आराम से now you understand right for next 45 minutes you just understand the topic okay? Will not answer any of the other questions those questions are coming but we keep them on hold chalo I'll just write down but then we start with our topic because this discussion is endless right? This is the email address this is the email address which will always be like a link between you and me. I'm writing it in capital so that question मुझे पता ही था it's in small letters this is for understanding till you are Mbbs right at gmail.com बस दोस्त email कर देना. We start with the topic. So our first topic which is coming up is cellular fluid. So we'll take it like a body fluids. 60% as compared to weight, 60% is water. 60%. So if there is a person weighs 80 kilogram, so then it is the 8 is 48, so that comes to 48 kilogram of water. That much water is inside. Now where this water is? In order to understand this water, we see that these are the cells. This is a cell. The entire body is made up of cells. So there is some water which is inside the cell and some water which is outside the cell. So very truly, one which is inside the cell will be calling it intracellular fluid. One which is outside the cell will be called extracellular fluid. So here it is intracellular fluid and the extracellular fluid. Intra and the extracellular fluid. Very easy. So 48 kilogram. It is the combination of ICF and ECF, intracellular fluid plus the extracellular fluid. This intracellular fluid, that comprises of two-third of the total body water. So that means cells, they are holding much more water as compared to the water which is around the cells, which is outside the cell. Because ECF, extracellular fluid, is just 1/3. That means our 32 kilogram out of 80 kilogram of the body weight, the person is having 32 kilogram of water which is inside the cells. So now if anything happens to this fluid, it can lead to major changes in the body. Right? We are talking about the body fluids, and 60% of the water, 60% is the water, that is 80 kilogram person will be having 48 kilogram of water. And this water is distributed in two ways. One is what is called as the intracellular fluid that is inside the cells, and the second is extracellular. Extracellular means it is outside the cell. And how is the distribution? Intracellular fluid is two-third of the total body mass. So जितना भी अपना total mass था 48 kilogram, out of that 48 kilogram, 32 kilogram is intracellular fluid. Rest 16 kilogram, that is 1/3, that is the extracellular. So this means what? This means what when we say extracellular? Extracellular means this is our blood vessel, correct? That's our blood vessel. That's our blood vessel. Any of the artery. So that artery will be having blood, right? Blood is. Now in that blood there will be RBC, WBC, platelets, right? All type of blood cells. And they are cells. The moment we say cell, that means in that there is water. So whether it is RBC, whether it is WBC, whether it is platelet, whether it is any of the cell of the body, but inside the cell, whatever the water is intracellular, and all these cells, blood cells, they are floating into a liquid component, and that is the plasma, right? So this extracellular fluid, when we talk about plasma, when it comes to blood. When it comes to between the cells, so it is also called as the interstitial fluid. This is another fancy way to tell that this is a fluid which is in between the cells, right? Between the cells. Fancy way of telling that this is fluid which is outside. This is like your flat. This is अपने पड़ोसी का flat, right? And this is that alley in between, right? इसका रास्ता. So this is anything over here is intracellular. यहाँ पे intracellular. जो बाहर है, this is extracellular. Simple. Okay. Now we need to measure it. We need to measure it because any change, increase or decrease, will अब measure ऐसे थोड़ा कर सकते, right? One of the thing is like take the entire fluid out, weight it, and then put it back. Not possible. We can't do that. So there is a smart way. This is the principle. Say 1 liter पानी. In that 1 liter पानी, say suppose उसके अंदर आप 100 ml ink डाल, reading 100 ml. The color would change, and then you take a sample out of it. Now यहाँ पे तो बोल दिया that this water was 1 liter or the 1000 ml. 1000 ml में अपने 100 ml ink डाली, तो बोल दिया. But what if we really don't know? We don't know. Unknown volume, पता नहीं कितना volume. Yet we just put 100 ml ink. 100 ml is known to us. So now we take a sample. इसमें से 100 ml निकाला. And we calculate कि अपनी ink कितनी है once the things are mixed. And we find it is 1 ml. So that means on 100 ml of water, there is 1 ml of ink. Right? So this means this is 100 times. So यहाँ पे अपना 100, so this means this water is 10 liters. ठीक है ना? 10 liters 100 times. और अगर जो से suppose यहाँ पे 10 ml ink डाली, and we find that in 100 ml there is 1 ml of ink. Right? So we know now that it is 10 times. So then that means water is 1000 ml. So in 1000 ml we added 10 ml of sample nikala. So this is how we can estimate the unknown volume. How shall we be doing this thing in our body? Again, very simple. You take a specific amount of this. They are called as the specific indicators. These are the indicators. So you inject that indicator. Now we don't know that how much is in the, how much blood it is. We inject, let's say 100 ml, and then we take a specific sample and then we calculate. And from that we will be able to figure out that how much is the total volume. Right? This example, if you have understood it, right, same thing will be what will be doing in the real human body. What it is assumed that indicator has been thoroughly mixed. Calculation part not understood. Very simple. 10 ml ink, right, in some X amount of water. अब sample लिया, and in that sample there is 1 ml of ink in 100 ml of water, because 100 ml का sample it is jug में से. So in 100 ml, if it is 1 ml ink, right, तो जब 10 ml ink डाली थी तो total कितना हुआ? True. Now is it okay? Right? Because here it clearly tells that how much it is. 1 ml ink is in the concentration of 1:100, right? Because that's the sample you take. Understood? Very good. Shabash. Right? So यहाँ पे भी just add zeros. This is 1000 ml. So is it? But if you understood this calculation, the principle is volume is equal to amount upon concentration. So in body, it is assumed indicator has been thoroughly mixed. Right? It has mixed in the body. This is 10 ml, right? First, have you understood that what we did? This is unknown volume. पता नहीं कितना volume है इस जग. There is some water. Just put 10 ml ink. 10 ml ink mixed, पूरा mixed. Out of that, you just take out 100 ml. Test tube में 100 ml निकाल. And then we find इसके अंदर there is 1 ml of ink. So we have got 1 ml of ink in 100 ml of water. But how much ink was added total? Total was 10 ml. So then how much would be the water? Got it? Right? 100 ml water. 100 ml water. 1 ml ink. Total ink was 100 ml. Right? So how much would be the water? So proportion. Just proportion. Ink to water 1:100. right? So this is 1:200. But how much was the ink added? 10. What if we don't have 100 ml water? 100 ml water? Why? What's the question? What's the question? We don't have 100 ml water. This is for understanding, na? Write down more. What exactly is in the point? Because in one jug, अरे तो दोस्त मेरे unknown, this is unknown ना, out of which in test tube तो you can take out known amount of sample ना. If you want to take out the blood, so you will take out the blood in a specific known amount. This is the known amount. This is known amount. जो निकाला है sample, तो sample is known to you. This is not unknown. The total volume is unknown. You got the idea? This is unknown. This is X. बाकी के सब मुझे तो पता है. You have added how much ink, that you know. How much water you are taking out, that you know. You have got a method to figure out कि कितनी ink है इसमें, right? So many methods to figure it out. So that is known to you. What's the problem? तीन चीजें पता है तो चौथी चीज निकालने में क्या प्रॉब्लम? It's just a simple अपने यार 10th 11th में ratios जो पढ़ते थे ये तो है, right? The ratio is 1:10. This ratio is like what? Sample, right? अपने sample में 1:100 का ratio. तो real में what was added in real? This is ink and this is water, right? Proportion remains the same. So yeah, if it is 100, तो यहाँ पे भी you have to add 1,000. Done. That's right. Correct. So 1,000 ml. So there are various indicators. How you need to know these indicators? Yes, you need to know. नहीं, you need to remember. याद रखने पड़ेंगे. Because these are the indicators which will be actually utilizing. जैसे देखेंगे ना तो there would be few questions on how to calculate these indicators. अभी कुछ नहीं, but दिमाग में रखना. Indicators, so they will be for ICF as well as ECF. Okay? ICF as well as ECF. Because the moment you inject anything, that will go into the cell also, that will go into the surrounding the cells also. सब जगह पे that thing will spread. So total body water, for total body water, this is deuterium and tritium. These are all very special. Deuterium or tritium. These are the substances which are called as the indicator of most important thing to understand is what we are talking about, the ECF and the total body water. Total body water means deuterium and tritium. Right? These are isotopes. That's right. They will be entering into. That's right. They will be entering into cells. Here is a cell, so they will be entering into the cells also. So they will be surrounding to honge, but they will be entering into the cells also. So thus evenly distributed. And when we calculate, it will be the total body water. Right? One. The second is, this is to calculate the ECF. ECF means that amount of fluid which is surrounding the cells, not inside. It's ICF means only surrounding the cells. So for that, we substance which should distribute across the whole body, but it should not be able to enter into the cell, right? That means they cannot cross cell membrane. Now this is interesting because if they cannot cross the cell membrane, that means they will be remaining outside the cell, right? Outside the cell. That means they will be ECF, extracellular fluid. So once they are outside and then you measure it, and wonderful, what you have done is you have calculated. Yahan se, from here, you have figured out the total body water. Tritium is radioactive. Doesn't matter. There are so many radioactive labeled substances which are used. But yes, you need to take precaution. At the same time, not every radioactivity is dangerous. You have to take some precautions. Total body water wala samajh mein aaya? Simple. Deuterium or tritium. That means these substances, when you check, they will be going into the cell and they will be going distributed across the entire body. So total body water will be. So principle would remain same, right? Say for example, you have injected how many units? You have injected 10 units, and then you are taking out a sample and you find that it is the in 100 ml of sample there are 0.5 units. So बस proportion में calculate किया तो you will come to know that the total body water is 2000. This is just an example. Right? Same what we did here. Right? Same. So the deuterium and tritium, they are injected, they will be giving total body water because they will be going inside the cell and they will be outside the cell also. That's why total body water. Got it? So that's what I said. Na? Now it should be clear, simple. Hai. It goes inside the cell and outside the cell. दोनों जगह पे है. So when it is both, so it is total body water. But what if the substance like insulin, glucose, mannitol, and sodium thiosulfate? It is sodium thiosulfate. Sulfate. All these, they won't be able to enter cross the cell. So now, if the things are like this, right? Say, एक सेल दूसरा सेल तीसरा सेल 4 से 5 सेल 6 सेल all cells, and you inject sodium thiosulfate. That sodium thiosulfate, right? It will go, but it won't be able to enter into the cells. Right? It will remain just outside the cell. Cell के अंदर नहीं जा सकता. And now you take the sample and you calculate it. So what you will come up with? Extracellular fluid. Correct? So when we inject them, they spread throughout the body like the entire body except ICF. Beautiful. Exactly. So when you inject, they will be going into the entire body except cells. That means intracellular fluid line. So when you take a sample, the result what you will be getting, that will be for the ECF, extracellular fluid. How small, right? Because cell के अंदर तो जा नहीं सकते. So whatever the distribution it is fluid which is extracellular fluid. So in ECF we have to measure all of the 4 to know the total body function. Which all 4? No, these are insulin. You can inject insulin or sucrose or mannitol or sodium thiosulfate. These are all indicators. All there are so many. Right? These are just the form. Any indicator can be used. Some of them they will be having effect on the kidneys. For example, mannitol. Some of them will be having effect on your glucose level. Say for example, this insulin. Right? Insulin. So every indicator has got side effects. Every indicator has got some physiological effect. So that is when we are still telling that these are the indicators which can be used to figure out the extracellular fluid. There is no technology in the world. Yeah, they are just to find the volume. There is no technology in the world, but you can straight away find in ICF. That's the thing. That ICF, there is no substance like ICF, means indicate like a injection should not go to, it should not go here, and everything should be going inside the cell. Right? बाहर कुछ नहीं रहना चाहिए, just into the cell. So that is not possible. So simply what you guys, yes, very right. Yes, good on you. Right? The total minus ECF, that is your ICF. So what's the big deal that when it is asked that, okay, what are the indicators to find ICF? None. So none. There are no indicators. It is so simple. इतना समझाने के लिए, right? Sometimes when you read the books, you'll find कि इतनी complex language क्यों use करते? They are such. चलो. So here it is, right? Plasma volume, radio labeled. So when we are asked to find the volume, so you will be given all parameters needed. So total body water is equal to ICF plus ECF. Very clear. Children, they are having 75%. more water, 75% water as compared to adults, because in adults we talk that it is about 60%. In males, it is 60%. It is more as compared to female. In case of male, it is 50%. So when you do exercise, there would be decreased fat, and then there would be more of the muscles. Right? When you exercise, there will be decreased fat and more muscles. Radioactive albumin, that is also one of the indicators of calorie. That's right. So the point is that body water is inversely proportional to body fat. Body water is inversely proportional to body fat. So those who are exercising, right? When I say all of you will be drinking 3 liters of water a day, honestly, bolo, how many of feel like that? Yes, I should be slim, I should be this, that, right? We do exercise, थोड़ा खाने में भी कट किया. This is so simple. Body को. Body water is inversely proportional to body fat. You know? So if you drink just simple plain water, if you can drink 4 liters, it is fantastic. And there is nothing like water toxicity. It is too high when it is more than 8 liters. 8 liter कोई नहीं पीता, right? So in YouTube, sometimes people are just to get the views कुछ भी लिखते हैं. इतना पानी पिया तो मर जाओ. And then they will be telling, and in the last they'll say then that it is the water toxicity, which is when person drinks more than 8 liter. तब तक डराते रहेंगे, ये इसके ऊपर ये कर सकता है, वो कर सकता है, all nonsense things. Right? They write anything. I recently saw one video. एक वीक में 11 किलो वजन मैंने कम किया. Yeah, that such type of videos. 3 दिन में 4 किलो वजन कम. Now it's all total nonsense, utter nonsense. Because just to decrease the weight by 400 grams, you have to go for the deficit, 3,500 calorie deficit. 3,500 calorie deficit. You want to decrease by 4 kilogram, there has to be 35,000 kilogram of calorie deficit. It's crazy. It's crazy. Right? No one can do it. But kuch bhi, I mean, on YouTube, they tell me. So don't trust. This is now you are a doctor. You know that body water is inversely proportional to body fat. So if you'll be having more body water, automatically the fat will start cutting off. Plus, it will be giving you filling effect. Plus, seriously, because it is this water which will be circulating into the heart system. And when it will come to your periphery, when it will come to your skin would be glowing. So that's the beauty of plain simple water. And yes, that is true that these celebrities, their water consumption is actually, आपने देखा भी होगा, मतलब एक water bottle साथ ही रहते हैं. So yeah, you have to burn. नहीं, you have to. It is a calorie deficit. मेरे दोस्त, calorie deficit. Calorie deficit का मतलब क्या? I don't know, because from the name this Vivo, I could make out female. But let's say if you are a male, so then it is 2,500 calories which is needed. In case of female, it is at least say 2,000 calories which is needed for your sustaining your basic body, right? Otherwise, heart, brain, you can't lose weight by compromising your heart or lung or brain. So ये तो calorie जो है. So what you can do is you do exercise, say for half an hour you run, you will be burning about 500 calories, right? So 3,000 calories आपका consumption हुआ, and then you eat anything extra. जो normal खाना पीना है बस उतना ही खाना पीना किया, so that by the end of the day 500 calorie की deficit आए. You do it for 7 days, 7 दिन तक रोज आधा घंटा दौड़े, आधा पौना घंटा दौड़े, and no extra मिठाई, cheese, this, that, nothing. Simple, normal khana, what you are eating right now. There comes 3,500 calorie deficit. Then you will find when you stand on the weighing scale, your weight is by minus 400 grams. That is 1 pound. That's the thing. That's the reason consistency. Yes, the thing is, when we go to gym and when initially right? What the weight which you lose is the water weight. So it happens like say 5 दिन में एक 2 किलो का वजन कम हो जाए. And then when you keep on doing very heavy weights, right? Heavy weights, something what is called as the burning, after burner. Even the exercise has been stopped, still you are burning the calories. There are specific exercise for that. So that way, yes, you can reduce the weight a bit faster. No recording, we don't have. Everything is live. Yes. Surely try to do that. Lose 3 kilogram in 1 month is perfectly realistic. Absolutely realistic. It is totally good. So special fluids, there are special fluids in our brain, that is CSF, cerebrospinal fluid, right? For joints, it is synovial between joints, because joints, they are like a gearbox. If there is a joint, so then it is sealed, and inside, in between, we have got what's called a synovial fluid. Right? So these synovial fluid, they will be acting like a gearbox oil, right? Gear oil. So in which case, as the age increases, this oil gets reduced. Right? So when the bone, they will come into contact with each other, they will start rubbing against each other. When they will rub, there will be friction, so they will start eroding, and that will be pain. Right? I think what is called as the arthritis. Yeah, that's 5 kilogram of muscle gain will take almost a year. Sure, it will take more time. And we'll talk about these things in more detail. Definitely, we'll talk about it. So that's the reason that say synovial fluid, which is over here. So when you exercise, right, this synovial fluid, this is not a dead thing. बस जब से जन्म लिया तब से whatever the fluid which is there, बस उतना ही fluid. It is formed every day, right? It is a continuous process. So that's why the blood circulation is so important. So when you do exercise, as if it is this fluid is getting absorbed and created, right? So systems, they keep on working very fine, very effectively. Those who don't exercise, they will just increase the weight, so that weight will be pressure on the knees, and it is the knees, they are the worst affected. Then surrounding the heart, there is pericardial fluid. So this pericardial, peri means surrounding, peripheral, surrounding, cardial is heart. So surrounding the heart, there is a, because this heart, which is world's best pump, which keeps on working for 80, 90, right? It keeps on working non-stop, day and night, not a single halt. Because even if it takes one halt, right, immediately you will know, right? So this pericardial fluid, it is that wonderful thing which gives the heart environment in which it keeps on working, keeps on beating. Now, if you are overweight, why I'm giving you this warning? You are a doctor. अगर जो डॉक्टर को समझ नहीं आए कि you need to take care of your body, then who is at fault? It's simple. Gym जाते हो, there is one device, right? Stand on it, and when you stand on it, there is a machine, right? So it will measure, it will calculate the current which will be passing through the body, and then it will come up with one indicator, and that is what is called as visceral fat. So many questions have been asked about the gym. BMI machine. Yes, Neha, you are right. So visceral fat. दूसरी सब चीजें होगी, but do figure out this visceral fat, because visceral fat is stuff, right, which is inside. Visceral fat is surrounding the organs. Visceral fat is which is surrounding the fat. So imagine it is like गाड़ी चलाते हैं, you drive, right? You apply the brakes and then you give it. Same thing is happening. The organ which is supposed to beat, right? Surrounding there is fat which is restricting it. There is some normal amount of cardiac fat which is totally normal to keep it good. But when it is extra visceral fat surrounding every organ, that's the trouble. This visceral fat which will be going into the arteries and they'll be decreasing the caliber. increasing the caliber. Young age में नहीं पता चलता, but you must have noticed that young age में, and just yesterday, Indian Medical Association they said those who are under 25 they should go for their lipid test. Why they say that? They said that almost was shocking that 85% of the youngsters they are going for outside food. Yeah, they are going for outside. I'm telling you, they are going for outside food more than 2 times per week. More than this is like this was about the junk food. Now in junk food, say if anyone's relative or parent they are in hotel, but I need to say this thing. The junk food it consists of monosodium glutamate MSG, and this MSG generates a craving. It's how, right? It is good for business. It is killer for the body. They use this monosodium glutamate. इतनी खराब चीज. It is so worst. That's why Indian Medical Association said that everyone should go for their lipid profile. Lipid profile. I'll teach you the entire in 1 or 2 lectures. We'll discuss how to see the medical. Yes, Shubhada, if you drink so much of water, right? If you can drink 3 liters of water, that will stop the craving. Because many times, if you are emotionally disturbed, ना, वो पागल की तरह खाए जा रहे. You are eating anything because brain is busy somewhere. ESR is erythrocyte sedimentation rate, which is a very important indicator. 1 hour, 2 hour, those 2 things are quite interesting. So पागलों की तरह खाए जा रहे हैं. मैच देख रहे हैं, अरे यार 6 मारी, right? खाए जा रहे हैं, अरे आउट हो गया, खाए जा रहे हैं. That thing is going into the body, those extra calories, just to make it tasty, right? They add so many junk things into that. So junk packet ki piche, there are so many things written, right? And will decipher. In one of my videos, I took the name also, that these actors, these cricketers, अब पैसा मिले तो they can talk anything. कोई भी third class चीज and which is consisting of such two things, right? And they are telling this is tasty, right? When such a big cricketer ने बोला कि healthy, तो बस healthy. When you see it, you will find that this is sheer nonsense. But पैसे के लिए, पान मसाला तो वो बात ही भूल जा. I don't have any respect for those guys. कुछ भी बोलते हैं. Right? What pan masala? I mean, what they say that yes, girls would be impressed if you eat this pan masala. Ask any girl. यहाँ पे इतनी सारी लड़कियाँ पूछो, तो pan masala खा क्या रहे? Will you be impressed? बात करते हैं. See, I doubt there would be even one single yes. Rutuja said, oh. So that's the thing. That is the thing. But because exactly, sorry, that's it is yuck. Exactly, this is the thing. But पैसा दिया तो कुछ भी बोले जाते हैं. Yeah, you're right. हाँ. So coming back to this lipid profile, ये ना अभी जरूरत नहीं है, पर whenever you get time, आप सब ना अपना एक ये रिपोर्ट, don't cost you even 600-700 रुपए, 1,000 rupees maximum, 1,000 rupees. ये लिख लीजिए, CBC, विटामिन B12, D3, LFT, RFT and lipid profile. बस बहुत ज्यादा करने की जरूरत नहीं है. This much. आजकल क्या है? There are packages available. So in one package they give you such discount, इतनी चीजें 1,000 रुपए में हो जाती है. Otherwise, if you try to go for individually, the whole bill बढ़ जाएगा. Don't go to any of the local laboratory. You are smart enough. कितने सारे apps हैं? They give you all these things in one package. And ये क्यों? See, right now all of you are healthy, right? Okay, I'll come to that. LFT is liver function test. Sorry, liver function test. RFT is renal function in short, renal function test, and this is renal. Renal means kidney, right? Renal function test. इसी के अंदर ESR आ जाए. ESR is नहीं मलेरियल पैरासाइट वगैरह क्या. आर यू हैविंग एनी फीवर और वो विडाल टेस्ट और कुछ नहीं. जस्ट डू दिस वन, बेसिक टेस्ट. इसके अंदर मैंने D3 इसलिए बोला, समटाइम्स दिस इज फॉर फिल्स. से D3, this is osteoporosis. This is very common in case of females, Indian females. These are weak. So D3 level और अच्छे मतलब when you will find that ये तो करोड़पति हैं, और जब उनके वो D3 टेस्ट किए तो D3 was coming such a level as if they are living in Somalia. इतने कम लेवल, आपने गलती से एक मुक्का मार दिया तो फ्रैक्चर हो जाए. So D3 levels should be very proper. The cost of the D3 treatment is 60 रुपया महीने का. 60 rupees, right? It is that cheap. And then if someone develops the fracture, अपने स्टूडेंट थे, उन्होंने कहा सर फ्रैक्चर होता है. I said send the X-ray. X-ray देखा तो मैंने first question was कि बस तू कुछ खाती पीते नहीं है? Are you on fasting since 6 months? Because the bones were so weak. Normal D3 level should be about 40 plus. 40, 35, 40 तो होना चाहिए. Her D3 level was 7, and like they are करोड़पति, they are superlative rich. So thyroid test वगैरह अभी मत की जरूरत नहीं, but you can do it in case if अगर जो ऐसा कुछ हो. CBC is complete blood count. आराम. CBC is complete blood count. इसमें सब आ गया. TC, DCR, ESR, erythropoietin, then ASR, then hemoglobin, MCHC, all sub-art, all those parameters. So CBC, if you tell this much to any of the lab, sub-art. And then such low levels, they can also be dangerous, and because you will be using your brain so intensively, so that is B12, that is very much needed. This last one is the lipid profile. It is lipid profile. And these tests, they will be telling you about the baseline. How much is your baseline? Future में कोई भी टेस्ट आपका प्लस या माइनस हो, tell you can go for this treatment, and once your treatment is complete, suppose किसी का D3 कम आ रहा है, it will cost you about 64 rupees, precisely 64 per month. That is. So after 3 months, you can repeat that. D3 level has gone up. You yourself will start feeling so much better. कई बार नहीं लगता? मतलब the day totally exhausted, right? बैठे भी हैं तो वो यूं टेढ़े बैठे हैं, ऐसे बैठे, can't even sit straight, थक जाते हैं, right? Many of the students they say, I say चलो यार 20 साल की उम्र में थकते हो? हाँ बिंदास, just send a mail to me, send your reports. इसमें पूछना. So coming back to this topic, osmosis. Osmosis is nothing but high concentration. Only one principle. Here is पानी लिया, इसके अंदर में बादाम डाली, almond, and next morning see that is swelled, right? So no. Ions, why? Sodium, potassium, अभी क्यों करना है? I have not missed, because yes, I can give you a complete list. Go for all the tests. But why? These are the basic tests. Say in case if someone is having any specific, say arrhythmias, right? Heart में problem, heartbeat हो गया, and then you are finding something uncomfortable in that patient. Then we can define that what is to be done. See, in case of females, in this age, many times the estrogen progesterone level, they are fluctuating. So if they are fluctuating, either the periods are very heavy or they are very scanty. If they are very heavy, right? Yeah, exactly. You're right? So it could be because of, say, PCOD, or there could be some other reason, or even the hormones they are getting established. But whatever the reason, if there is increased blood loss, definitely there would be fall into the hemoglobin, right? Now, unless and until you don't check it, you won't be knowing it, right? And then one day you just check the hemoglobin. If it turns out to be 9, now you don't know whether the situation is bad or the situation is okay. If that basic test has been done, and you know that before 6 months it was 7.5, very low, and now it is 9, happy. It means you are improving. Your B12 level is that low? Arey baap re. Start taking sublingual tablets. Don't even go for those tablets which are to be swallowed. Go for sublingual tablets. Those sublingual tablets. Right? Because you just put it under your tongue and it will be absorbed. So once it is absorbed, then that will give you much better result as compared to when it goes into the stomach. It has to pass through the liver. When it passes through the liver, rate of absorption that decreases. Okay. Chalo, coming back to this osmosis, you put an almond into the water and the water next morning is mute, those mute. So osmosis is high concentration of water. Someone is traveling and shabash, who is it? We should appreciate this person. Even if he is traveling, he is listening. Yeah. So regarding ICF, acha, this part, I was, yes, we'll come back to this part you are talking about. These ends you are talking about, we'll come to that. We'll come back to it. So over here, when we say osmosis, there is high concentration of water and there is low concentration of water. So, yes. So this is solute, low concentration to solute, high concentration. This means what? That this is the almond. Inside the almond, there was less water. Outside, there was more water. Water always goes from where it is more to where it is less. So it will go inside. Right? So the point is, it is the water movement. Always the water movement. Even in our body also, it will happen like that. Right? Either the water will be going from extracellular fluid to intracellular fluid, or it will be going from intracellular fluid to extracellular fluid if the ionic concentration is different. If you can wait for just 5 minutes, we are up to complete. Right? Because this much will take just 5 minutes. So just in 5 minutes, we'll be able to complete the session. And in any case, in the next class, we'll be revising this entire thing and then we'll be going for the clinical part. So even if you miss something, don't worry. So here it is, the ECF. ECF is having some ions, sodium, right? So how to remember ECF? ECF is external. External means it is ocean, samudra, right? It is outside. So salt, there is so much of salt in the ocean, right? That's why sodium chloride, right? So there is so much. So that is the salt which is outside. Cations, Na plus, anions, a negative ion, that is chlorine minus. Intracellular, there is more of the potassium and the magnesium and the phosphate. This will be the basic game plan for all the arrhythmias. When the heart is not beating properly or when the muscles they are working, how they are working, action potentials, everything will be revolving around this as the water moves from higher concentration to lower concentration. Right now, we are not talking of, we are discussing this osmolarity and osmolarity. So that is what we'll be discussing next time. This is what we'll discuss. That is what is called as the DY diagram or the Darrow-Jonet diagram. Yeah, Darrow-Jonet. What Darrow-Jonet is telling, the principle is addition or loss of fluid, right? Someone gets burns, right? To jal gaya. That means extracellular fluid lost, right? खूब exercise की, sweating, the water loss, right? The water loss. So that would be extracellular fluid. Osmolarity of ECF, it is the shear fluid that will continue till osmolarity of intracellular fluid and extracellular fluid is same. That means the amount of solutes, right, in the ICF and the ECF both become same. So here it is. This is the extracellular fluid, and then there is loss of fluid, right? Loss of fluid. For number of salts which are over here, they will remain same. Salts here also, but in the same proportion. So if there is 1 unit of salt over here, and there are 2 units of salt over here, and then there is 1 liter of water over here. So here there will be 2 liters of water. Proportion should be same. But now if there is 0.5 liter of water lost, so now this thing, right? Now this has become 0.5 liter. That means relatively concentration of this salt has increased, right? Because concentration has increased. So water from intracellular fluid that will try to come in over here and balance it. The concentration remains same. This is the point when we are starting today, and this is the point from where we'll start day after tomorrow. Right? No worries, everything would be repeated right from the first point and last point. Everything would be repeated. So thank you so much. And just for the test purpose, now I'm transferring this file onto our chat just to see whether all of you are getting it properly or not. I am transferring the file now. Just a minute, just a minute. For some reason, it's not coming. चलो कोई बात नहीं. I'll day after tomorrow. I think they will be going for biology and the chemistry. No, I haven't sent. I think there is some issue, right? It is. I'll just test it next time. I'll just test it next time. So day after tomorrow, I'm just doing it. Just calling it.
Sir,
Yes, tell me.
so you can do one thing. You can just show us the slides from the beginning. We can take a screenshot.
Why not? Why not? That thing can definitely be done. Never a problem. And what I'll do is get to
वो
over here entire page.
वो एंट्रेंस एग्जाम होने वाला है ना, उसका इंफॉर्मेशन बताइए तो.
That I know. That I don't know. This is like entrance examination के लिए they must be asking biology or chemistry. That ये दो चीजें पूछते हैं. But ये क्या कि it varies from university to university. So वो जरा आपको कंफर्म करना पड़ेगा कि कौन सी एग्जाम है, कौन सी यूनिवर्सिटी.
ओके ओके.
Saturday we talked about brain mapping. We talked about brain mapping. We talked about almost all the things what we discussed today. We talked about some books also. Okay, this is page one. On to the page two. This is page two. It's page two.
Sorry to interrupt, sir.
हाँ बोलो.
Sir, can you please show page one?
Page one. Next page. Over here also, usually it is easy, but I think there is some problem. I'll just sort it out everything by today. From next time, there won't be any issue. Next page. I know. This is, in any case, you'll be getting. I'll do one thing. In this, we'll be continuing with this PDF only next time. Right? So, but this is, you just follow it. You just manage, and so that you can revise. You should be able to revise the things. Plus, there are 7-8 pages. Not much. No, Zoom code, it is not randomly generated. I have created so that you can remember it. So that's the page numbers. The next page. Speech. See, if your score is good and you take admission in India, it's fine. But otherwise, the amount of money which you spend, it is phenomenally high. Score of 562. Because they say what happens is the amount of money which you end up so high when you are looking for any of these private colleges. Yes. On Thursday, all these things will be repeated. So in first 5 minutes, we'll take this, then we'll be for the clinical aspects. And the moment you learn clinical aspects, these things would look so simple. Next page.
Auditory.
Next page. So there are 11 pages to this one. Sure. Prior to this, many pages left out. That will you be teaching the student are going to Georgia, sir? I teach students. My students are in 29 countries. You don't have to write, just take the screenshot. This is for revision. Next time, definitely getting this PDF along with the newer one. Entrance exam for the university, well, it depends upon the university. You confirm it with the management, with the counselor. Ask this. Ask, because not every college will be having entrance examination, but some of them they will be having. So just confirm it. These notes you don't have to write. Just go through it. Next time, to in any case, you. I told you my YouTube channel is under the same name, Dr. Bankim Jani. And what you have to do is go over there and go for the upper link. Yes, it is with this name. And the email address is TILLURMBS@gmail. So for any query, just let me know. So you don't have to write this. Just go through these points. Next time I'll be giving you the details. Okay. So wish you all the best. Study well. And start the anatomy also. Physiology in any case we'll be discussing. Okay. Take care and see you day after tomorrow. Bye-bye.
Thank you, sir.
ये धीरे 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 आवाज जोर से आ रहा है धीरे ऐसा लग रहा है ब्रश से कोई घिस रहा है बहुत जोर जोर से बस थोड़ा हाँ देवेनी के पास थे ना कांदा मसाला हे झालं शुभंगी जॉइन अ मीटिंग सीन असं आलं स्क्रीन हां